Hi, my name is Donna Sikta. I'm a school nurse at Indian Fields, and today I'm going to talk to you about sleep, the lost priority. Only 25% of American adults get the reported 8 or more hours of sleep required, according to the National Sleep Foundation. Maslow's hierarchy of needs at its base shows us that in order to become self-actualized, we must meet certain needs, starting with physiological: air, food, water, shelter, clothing, and sleep. The effects of sleep deprivation on the human body are multiple. Take a look at some of these. There are many causes for insomnia. They can be medical. You can have major depressive disorders that disrupt your sleep cycle, anxiety, whether they be a chronic disorder or that it's according to what's going on in your life at the moment, lifestyle, and food. The first order of business when people experience insomnia is to go to the drugstore and find something that usually has Benadryl. And as you can see, Benadryl is not without side effects. Next, people often reach for melatonin. Melatonin is considered to be all natural and something that our body makes on its own. But it is a hormone, and there are no regulations to the dose or its production. And oftentimes it's prescribed at 10 times greater the dose than should be over the counter. Sleeping pills are not without their own side effects. You can develop a tolerance, drowsy driving, which can occur because you need 7 hours of sleep in order for them to metabolize. Often women or petite women will wake up in the morning and still be under the influence and thus get behind the wheel of a car and be considered under the influence while driving. Erratic behavior, sleepwalking, sleep eating, amnesia. It does not give you a restorative sleep because you will have less deep, rapid eye movement, and that is your restorative sleep cycle, dream state, and that causes depression. So what is sleep hygiene? Sleep hygiene is a variety of different practices and habits that are necessary to have good nighttime sleep quality and full daytime alertness. How can I improve my sleep? Well, there's several things that you can do in order to get your sleep under control. Limit daytime naps, and if you're going to nap, sleep under 30 minutes. Avoid stimulants, that would be caffeine, nicotine, even ADHD medications. Exercise 30 minutes daily, preferably in natural light. Avoid greasy, spicy foods, a regular relaxing bedtime routine. Have a nice sleep environment, turn off all electronics 2 hours before bed. Practice prayer, meditation, yoga to reduce stress. And of course, get an annual physical checkup to make sure that there's nothing underlying medically going on. So here's some examples of things that can help. A long walk outside, avoiding alcohol. The Kindle Paperwhite does not have blue light background, so it won't jeopardize your sleep with melatonin because there is no blue light in the background. Aromatherapy is proven to be effective, especially lavender. White noise makers can block out external stimuli that may be interrupting your ability to fall asleep. Acupuncture has been found to be helpful. Meditation, getting out in nature. A nice massage is always good. Say no to naps and use blue blocker glasses if you have to use electronics in the evening. Cognitive behavioral therapy is the first line of defense against chronic sleep problems, and it's recommended by the National Sleep Foundation. The cognitive portion teaches you to recognize and change beliefs that affect your sleep. So this type of therapy can help you control or eliminate those negative thoughts, those worries that keep you awake. The behavioral portion, however, helps you to develop good sleep habits and avoid behaviors that keep you from sleeping well. So it starts with something called stimulus control. The goal of the stimulus is to cause a response. Over time, this method helps you to fall asleep more quickly after you get into bed. You begin to have a positive response toward going to bed at night. Instead of being frustrated, it becomes relaxing and restful. And that starts with a consistent bedtime and awake time, avoiding naps, using the bed for sleep and sex only, leave the bed if you can't get to sleep in 20 minutes, and return only when sleepy. The next portion is sleep restriction. This sleep loss will help you feel even more tired at first, but will also help you fall asleep faster and wake up fewer times during the night. It will give you a solid period of sleep and a more stable sleep pattern. As your sleep improves, the limit on your time in bed is slowly increased. The goal is to reach the point where you get the amount of sleep you need without reducing the quality of your sleep. So, lying in bed awake becomes a bad habit and a bad association. You must reduce your time in bed, causing a partial sleep deprivation, thus increasing your sleep drive. And then once you're sleeping, those restrictions are loosened. We talked about better sleep hygiene, and that's also introduced at this point. You need to increase or improve your sleep environment as well. Create a comfortable environment. Keep your bedroom quiet. Keep it cool. No television in the bedroom, and always hide your clock from view. Use white noise to drown out external stimuli, and never put electronics in the bedroom. Relaxation training teaches you how to relax both your mind and your body. This helps you to reduce your anxiety or tension that keeps you awake at night. This method can be used both during the day and at bedtime. It involves training you how to better control muscle relaxation, breathing, and mental focus. This is done through meditation, guided imagery, muscle relaxation, and spiritual prayer or spiritual practices. Biofeedback training is also introduced. It teaches you how to raise or lower various signs of how your body is working. You're given the details of certain indicators in your body. Biofeedback can provide details in such things as muscle tension, brain waves when it's done in a clinical setting, and blood pressure, heart rate, and body temperature. Biofeedback helps you to observe heart rate and muscle tension, and then you adjust through release and relaxation. You can use a physical device to help you through this process, or many people use recordings. You will record your successes and failures daily to look for patterns and discuss with a therapist to identify issues that are affecting your sleep. Finally, there's something called remaining passively awake. Paradoxical intention is a cognitive technique that consists of persuading a patient to engage in his or her most feared behavior. Paradoxically, if a patient stops trying to fall asleep and instead stays awake for as long as possible, the performance anxiety is expected to diminish. Thus, sleep may occur more easily. So you have your paradoxical intention, avoid any effort to fall asleep. Paradoxically, worrying will keep you from falling asleep. So letting go of this worry will help you relax and fall asleep easier. Now, access to CBTI, cognitive behavioral therapy for insomnia, can be limited in this area, as there are very few sleep disorder specialists who provide CBTI training. However, any cognitive behavioral therapist will be able to walk you through this process. If you choose not to use a therapist, there are a number of online programs that you can use. There's a wealth of information on the internet about CBTI. You will be using a diary, and there you will normally finish the course in about 6 to 8 weeks. But the thing is, you, the subject, must be completely driven to change long-held habits that have stopped you from having a really great night's sleep. I hope you enjoyed this presentation as I enjoyed bringing it to you, and I wish you sweet dreams and a great day. Thank you.